Hey guys, it's Dr. Ben Baghi here with Pro+Kinetix Physical Therapy and Performance. Just want to go over with you today what a virtual consult or a virtual visit looks like with us and how we can help you. Whether you're out of state or can't make it in the clinic because of your busy schedule, then a virtual visit is a great option for you. So how does a virtual visit actually work? So once you complete the form below, we'll be in touch with you to learn a bit more about you, and then we'll match you with a doctor of physical therapy that specializes in your type of pain or injury. We'll email you the new patient paperwork, and this will allow you to tell your story, what makes it worse, and also let us know your past medical history. So you can fill that out and send it back to us, and then one of our therapists or myself will reach out to you to schedule a virtual consult. We'll send you a link to allow us to go virtually, side by side, live. This is where the initial evaluation begins. A good initial evaluation can solve the root cause of your problems by identifying different patterns. There are clinical things that we can do, and if it quacks like a duck, looks like a duck, it's probably a duck. So for example, disc herniations, Achilles tendonitis, shoulder impingement, all have their own individual pattern, much like other common injuries that we help people overcome day in and day out. By taking a history, asking the right questions, we will be able to get to the root cause of it, or at least narrow it down to 2 or 3 things. Once we narrow it down to 2 or 3 things, if we can't narrow it down to one thing initially, then we can use treatment, which will help us narrow it down to a singular cause, depending on how you respond to treatment. The evaluation will take up the majority of the time, but the main things we want to do is get to the root cause of your pain. We're not going to take some cookie cutter approach. The goal is to solve the root cause. After we go through the initial evaluation part of the visit, we'll go through some treatment. We'll be able to go over some repeated motion testing, stretches, some strengthening exercises, and see a response to treatment to make sure it's making you feel better. If you're active and wanting to get back to working out, running, or anything like that, we'll be able to guide you to what capacity you can return for the time being, and also go over modifications to allow you to continue to do that activity. We'll also be able to give you a rough estimate of when you'll be able to get back to doing those activities. After the eval is done, you'll receive a customized exercise program based off your initial evaluation that will be customized strictly to you for you to start working on, and so you can start making progress even after that very first visit. So what I'm going to do is I'm going to go ahead and share my screen with you guys so you guys can take a look and see for yourself what that looks like. All right, guys, so here's your patient portal. Following the evaluation, your physical therapist will be sending a link to your email. All you have to do is click that link, and then that will drive you to your patient portal. And then upon opening the patient portal, you'll see all of your exercise that you need to be working on until next time that you're in. It'll have the name of the exercise, how many reps you should be doing, how long you should be holding the stretch for if it's a stretch, and then also how often you should be doing these as well. And then you can scroll down and you can see special notes from us if we have included any. And then also when you scroll down, you'll see a video description as well as a written description of how to do it, what you should feel, and compensations to look out for. And we go through each individual exercise that will be added to your home exercise program in the visit with us to make sure you're doing it correctly. This will just help ensure that you're doing these correctly at home when we're not there. And then if you have questions too, you can also just shoot us an email or a text or a call if you have questions about these as well. So yeah, this is kind of what it looks like and what you can expect from your home exercise program. So yeah, that's kind of how a virtual evaluation goes. Following the evaluation, you will have 24/7 access to your physical therapist for any questions that you have. One question we get a lot is, are our diagnosis going to be accurate? If an evaluation is completed correctly, by you telling your therapist your story, us going over the mechanism of the injury, what makes it better, what makes it worse, what you're having pain with, how long it's been going on for, and asking the right questions, we'll be able to diagnose you just as well as if you were coming into the clinic. Going through your treatment after the evaluation portion of the visit is also a way we verify and ensure we have the correct diagnosis as well. Do you need manual or hands-on treatment that you would get from an in-person visit? No. Yes, it would help, but the main components you need to make progress is a correct diagnosis, the right exercises, and the right guidance, and we're able to give you all that and more in a virtual visit. Whether you're in a different state, too busy to make it in the clinic, we'll still be able to help you, give you a specific diagnosis, come up with a specific plan of care, depending on how you present during the evaluation. After the evaluation, we'll then discuss with you whether we're recommending you follow up once a week, twice a week, wherever it takes to get you the best outcome. This was an insider's look at what you can expect from the evaluation, starting off with the process of the introduction, receiving the patient packet, sitting down and doing the actual virtual visit, completing the evaluation, receiving the treatment on day one, and then a video-based program that's virtual, and then communicating via email, phone, or text until your next visit if you have questions for us, so we can make sure you're getting the results that you want. If you have any questions, you can send us an email or give us a call. Otherwise, go ahead and fill out the form below, and we'll see you on the other side in the virtual world. We want to let you know we're here to help, and there's no need to continue to suffer in pain. But yeah, if you need us, we are here to help and hope to see you on the other side.